Hi, my name is Alexis Soli, and this is my DNP project. My DNP project is titled Improving Care for Mental Health Disorders. My committee members, my DNP chair is Dr. Marella Harrington. My second reader was Dr. Lisa Struer, and my community member is Dr. Morgan Sanchez. According to the American Foundation for Suicide Prevention, there are over 100 completed suicides every single day in the U.S. People often struggle with psychiatric disorders for years before they ever receive help, and unfortunately, some people never receive treatment. A recent study displayed that out of 227 participants struggling with major depressive disorder, less than 2% ever attempted to seek treatment. Without knowing a psychiatric diagnosis, there is no way for proper health care to be provided. This describes why it is vital that we are able to deliver care at the earliest possible moment, such as during a primary care visit. Screening for mental health disorders in primary care will allow for proper diagnosis. This study aimed to determine if the use of the Patient Health Questionnaire 9, or the PHQ-9, in primary care could result in more psychiatric referrals. More psychiatric referrals could improve future treatment of depression and decrease suicide attempts as well as suicide success rates. The PHQ-9 is a screening tool that focuses on thoughts of self-harm, depression, and suicidal ideation, specifically within the previous 2 weeks. Since the PHQ-9 only assesses the patient's past 2 weeks, it is vital that this is used at every single appointment, since most people do not go to primary care visits multiple times in a 2-week period. Countless articles and studies have been conducted regarding the use of the PHQ-9 and other screening tools in primary care. Studies have shown that the use of the PHQ-9 in primary care has led to an increase in the number of patients diagnosed with mental health disorders. The current research focuses on the prevalence and incidence of psychiatric disorders. The following statistics and reports state that mental health is still such a prevalent issue in the U.S. right now. Individuals are walking the streets undiagnosed, people are suffering alone, and crises are happening due to the delay in treatment. According to the Journal for Nurse Practitioners, 60% of mental health conditions and 90% of individuals suffering from addiction are not properly treated. Serious improvements must be made to educate primary care providers and improve overall care for every single patient. Primary care clinics often use the PHQ-2, which consists of the first 2 questions of the PHQ-9. Those 2 questions include ratings of pleasure and interest in doing things, as well as feelings of hopelessness or feeling like you let others down with depression within the past 2 weeks. The PHQ-2 is effective in treating depression, determining depression for individuals with those symptoms, but depression can have many other symptoms associated. For the significance in nursing practice, mental health is such a prevalent issue that it affects all aspects of healthcare. Nurses must be the primary healthcare workers, focusing and performing those assessments in the hospital setting as well as in the primary care offices. Screening tools such as the PHQ-9 should be utilized by nursing staff and advanced practice nurses and physicians. This will allow for a higher amount of diagnosed mental health disorders. Due to a high patient load for providers, they have limited time to spend with the patients. Nurses can then spend more time with individuals and perform their assessments. In the hospital setting, nurses regularly screen for depression and suicide using the PHQ-9. If it is used correctly, there should be an increase in screenings and a decrease in undiagnosed individuals. The significance to advanced practice nursing. Advanced practice nurses must have advanced knowledge in topics that pertain to their area of focus. As I've stated earlier, psychiatric disorders are involved in every aspect of healthcare. It is necessary for all healthcare workers, including advanced practice nurses, to have enough knowledge to assess for risk factors as well as any possible current issues that person is struggling with. Screening and accurate detection of any problems would allow for the rapid and appropriate initiation of treatment. Significance to healthcare. Healthcare providers in each area, surgery, endocrinology, emergency department, primary care, everyone needs to be aware of mental health. Unfortunately, there's still a considerable stigma that's associated with mental health disorders, which leads to quite a barrier when it comes to providing care. To rid of this stigma, everyone across the span of healthcare must be educated and trained in handling this area of care. Research states that many aspects of healthcare remain the reason for such stigmatization. The leading causes of stigma in healthcare are destructive attitudes, lack of familiarity, doubt about the likelihood of any possible recovery, and also the avoidance to even discuss the topic at all. It is vital that healthcare workers strive to meet the current and emerging needs of American citizens for quality mental health care. There are 3 significant themes relating to my DNP project: depression screening in primary care settings, reliability and validity of the PHQ-9, and also the impact of social determinants on depression. Unfortunately, depression and depressive episodes continue to be one of the most common forms of disability worldwide. Depression screening in primary care setting has been found to be effective in increasing diagnosis and also referrals. Often, the individuals affected are women, but it can be men. Many factors have led to the ongoing concerns associated with psychiatric disorders such as depression. These issues include screening tools used, lack of resources, and socioeconomic status. By the time individuals seek treatment for their depression, physical symptoms have usually already developed, and the primary care providers tend to focus their treatment on those physical symptoms. People must have access to health care right away so that there is an increase in the number of diagnoses of depression, which will further lead to the initiation of treatment. Without the rapid initiation of treatment and possible referral to psychiatry, the likelihood of the worsening symptoms are going to occur. For the reliability and validity of the PHQ-9, since screening for depression is so important, the screening tool must be reliable and valid. A depressed mood is not the only problem correlated with suicidal ideation. Before the PHQ-9, the PHQ-2 was used to assess suicidal risk, but it was determined that it's just not enough. The PHQ-2 is a self-administered assessment that focuses on the patient's level of interest in normal activities and feelings of hopelessness and depression. Those 2 questions score range from 0 to 6. If the patient scores high enough on the PHQ-2, the PHQ-9 is then used to further assess issues. The PHQ-9 focuses on questions that assess if the patient is feeling like a failure, if they feel like they've let their family down. It is essential that all types of questions are being asked to address the root cause. A lack of resources and knowledge leads to an increase in the number of people diagnosed with depression and other mental health illnesses. Lack of knowledge can also lead to the misinterpretation of questions on the depression screening, which could lead to an inaccurate final depression score. If necessary, treatment can also be initiated once the diagnosis has been confirmed of a high enough number. To diagnose, there must be proper assessment completed on the individual's mental health. Studies discusses that the PHQ-2 does not provide an adequate assessment of the patient's thoughts to provide an accurate diagnosis. The PHQ-9 consists of 9 questions with answers ranging from 0 to 3. The answers mean 0, not at all, 1, several days a week, 2, more than half the days a week, and 3, nearly every day. The questions focus on how the individual feels in the previous 2 weeks. 27 is the highest possible score, which would mean severe depression, and 0 results in no depression. The higher the sensitivity and lower the specificity will lead to a number of positives, which could be a false positive. On the contrary, decreased sensitivity and increased specificity would lead to any missed possible diagnoses. Although the PHQ-9 does take longer to complete, the assessment can be self-administered, which may help people that are shy or have difficult time expressing their mental health needs. The impact of social determinants. Social determinants have been found to have an increase or an impact in the incidence and severity of patients with depression. Populations that lack resources, struggle with illiteracy, and do not have access to health care or do not have the means to maintain compliance tend to have a higher depression rate. These vulnerable populations could benefit from screening for depression in the primary care setting. All of these aspects can greatly hinder mental health care. The most common demographics that were compared were gender, age, marital status, and education, employment, and where the patient is currently living. With lack of access to health care and resources, there is a likelihood that treatment will be delayed or may never be initiated. Low income status was associated with higher rates of depression. Having children and access to mental health services were associated with lower rates of depression. There was a significant difference in the response rates of the people taking the PHQ-9, dependent on gender, sexual orientation, race, and also religion. Women and homosexuals finished the questionnaire more often than people of Middle Eastern and Black descent. The following groups were more likely to complete 100% of the PHQ-9: women, heterosexuals, homosexuals, U.S. citizens, Caucasians, and Christians. Least likely were men, transgender individuals, non-U.S. citizens, Native Americans, Pacific Islanders, people of Latin or Black descent, individuals that practice Muslim, Hindu, and Buddhist faith, and those that are struggling financially. Because mental health is such a prevalent topic today, there needs to be a better understanding of social norms and the social aspect of mental health. The framework that best supports this study is the theory of planned behavior. The theory of planned behavior was established from the theory of reasoned action, which was developed by Isaac Ashzen and Martin Fishbane. This theory focuses on social behaviors. Not only does the theory focus on why people do what they do, but it also focuses on why that action was taken at that certain specific time and place. It was determined that people's actions depend on two things: motivation and ability. One of the biggest problems with mental health care is the stigma associated. Individuals are looked down upon because they have a mental health disorder, so they're either scared or maybe ashamed to receive the help that they need. If stigma is not gotten rid of, people in primary care are not going to be willing to answer the PHQ-9 honestly. So it's important that we are able to better understand what's going on. The study used was a retrospective chart review. Step 1, the electronic medical record EMR was reviewed to determine participants that fit the inclusion and exclusion criteria within the previous 3 months. Step 2, the minimum data was collected. Step 3, the data process stopped once we reached 150 EMR. And then step 4, the information was destroyed. The charts were chosen by attending a clinic visit for a reason outside of possible psychiatric illnesses. The chief complaint was reviewed to determine that the individuals were not there for a psychiatric reason and that there was no past medical history of any psychiatric illnesses previously. To be included, they must be 18 to 80 years old, attend the clinic as his or her primary care office, answer all 9 questions of the PHQ-9, and be a native English speaker. They may not be over 80 or a child or adolescent, have a previous or current psychiatric diagnosis, have a previous or current referral to psychiatry, or be on any psychiatric medications now or previously. A data collection sheet was used to maintain patient confidentiality. The minimum necessary data was used, and then the charts were destroyed. The population is in a Midwest town of about 35,000 people. Female and male gender is equally split about 50-50. Breakdown over the ages are as follow in that table. In the bottom left-hand corner, you can see that there is an other category for 5.2%, and that other category consists of American Indian, Alaska Natives, Asian, and Pacific Islander. Data was analyzed using Microsoft Excel and SPSS, which is the Statistical Package of Social Sciences. The data collected on the collections sheet includes the participant's age, gender, PHQ-9 score, as well as whether or not a referral to psychiatry was placed. Data was analyzed to determine if there was a correlation between the use of the PHQ-9 and referral rates. The point by serial model was then used to establish the level of significance. The point by serial model was used because it accurately detects if there is a strong correlation between a continuous variable and a dichotomous dependent variable. It was determined that the use of the PHQ-9 led to psychiatric referrals. The PHQ-9 questions are as follows. In the previous 3 weeks, have you had any of the following bother you? Little interest or pleasure in doing things, feeling down, depressed, or hopeless, trouble falling asleep or staying asleep, or sleeping too much, feeling tired or having little energy, poor appetite or overeating, feeling bad about yourself or that you're a failure or have let your family down, trouble concentrating on things such as reading a newspaper or watching television, moving too slowly that people have noticed, or that you are very fidgety, and then 9, with feelings that you would be better off dead or hurting yourself in some way. The sum of the PHQ-9 scores were then determined. Other than a couple of outliers, most scores above 16 led to a psychiatric referral. You can see the ranges there. 30% scored 0 to 4, 25.3% 5 to 9, 22% 10 to 14, 18% 15 to 19, and 4.6% scored 20 to 27. 0 to 4 is the absence of depression or minimal depression. 5 to 9 is mild depression. 10 to 14 is moderate depression. 15 to 19, moderately severe depression. And 20 to 27, severe depression. Out of the sample size of 150 participants, 22% were referred to psychiatry based on a PHQ-9 score, and his or her history of present illness, review of symptoms, and a physical exam. Of those people that were referred, the PHQ-9 scores were 20% score to 16, 6.7 score to 12, 23.3 score to 17, 13.3 score to 19, 16.7 score to 21, 3.3 scored a 20, 13.3 scored an 18, and 3.3 scored a 23. After the point by serial correlation was conducted, it was determined that the level of significance was less than 0.001, meaning that there is a strong relationship between PHQ-9 score and the rate of referral. Retrospective studies look back to previously collected data by other individuals. So there could be absent data, or the data could be collected in an altered format from what was expected. Due to the stigma associated with mental health, some providers may not have been as eager to refer a patient to psychiatry, but on the contrary, some providers may have been more sensitive towards mental health disorders and put in a referral more readily. With a sample size of only 150, this study does not really have pronounced generalizability. It's not overly generalized. The research study was conducted in a smaller rural area, which places restrictions on sample sizes. After the analysis took place, it was determined that the PHQ-9 is an effective and efficient way to detect levels of depression to hopefully lead to psychiatric referrals. Out of the sample size of 150, 22% were referred. Since the participants included in this study did not attend the visit for a psychiatric reason or have a previous psychiatric diagnosis, it's unlikely that the visit would have led to a psychiatric referral without using a screening tool. Before beginning the retrospective chart review, a hypothesis was listed. A hypothesis and a list of expected outcomes were determined, and the observed outcomes well exceeded what was expected. Since this was a retrospective chart review, there were not and are not any direct benefits to the participants that were included in this study. Hopefully, this study will allow for improvements in the care for mental health disorders as a society in the future. The PHQ-2 does not provide an adequate assessment of the patient's thoughts to give an accurate diagnosis. The patient needs to be asked questions such as suicidal ideation and not just about their depressed mood. Along with leading to diagnosis, the PHQ-9 can also be used to evaluate the effectiveness of treatment once treatment has begun. After conducting this project, the recommendation would be that the primary care clinics use the PHQ-9 to assess for depression instead of the PHQ-2. One barrier to this project is that it did not happen in the current time since it was a retrospective chart review. After speaking with the clinic staff, it became apparent that some patient attitudes towards using the PHQ-9 could have affected the validity of the answers given. When it comes to staff, negative attitudes and lack of education on the PHQ-9 could have affected care given as well. One benefit, though, after seeing the results of this study, the clinic has decided to implement the PHQ-9 depression screening tool instead of the PHQ-2, so hopefully there will be an improvement in mental health care given. It would have been beneficial to compare the data and results of this study to the clinic's previous referral rates using the PHQ-2. So instead of the results, it would need to be conducted to compare to PHQ-2 previous studies outside of the clinic. I plan to ensure that the PHQ-9 is always used in my primary care practice once I graduate, and also during the clinic visits that I have during clinicals. It has always been my dream to be a nurse practitioner. This program at Maryville University has been beyond helpful with allowing me to gain enough knowledge to be a very successful advanced practice provider. As an RN, my focus has mostly been pediatrics. So with this program, I have been able to broaden my knowledge on the adult as well as geriatric population. Time for any questions? And here are the references. Thank you so much for listening to my project.